In this video, I'm talking about what is pay for performance in health insurance. And it's a fairly simple concept. It's basically where, in addition to the classic way the insurer pays the doctor, where the doctor bills the insurer based on what the doctor did, the insurer also has another system to decide how much to pay the doctor, which could be a bonus system or could be an adjustment to these numbers. And this other system of bonus is meant to incentivize good care, it's meant to incentivize quality care, it's basically meant to give a boost in the financial payment from the insurer to high quality doctors who are doing good things for their patients. And of course, there's a lot of different things that could go into a pay for performance report, like how do they decide which doctors are doing well and which doctors are not. And that could have to do with how much preventative care the doctor's giving. It could have to do with low use of low quality services. It could have to do with how often does the doctor adhere to evidence-based practices when they treat patients of a certain type. It could have to do with patient surveys and patient satisfaction of the doctor's care, or hospital readmissions. Basically, the insurance companies collect a lot of information from the doctors and sort of look at the overall picture of how good are they doing at treating this group of patients. And they try to come up with ways of deciding who's doing really well for their patients and who's doing things that they should be doing or failing to do things that they should be doing. So yeah, the classic system might be they just get a little bit of extra money if they have good scores on whatever the insurance company has decided to score. But you could also have it where if you're a well-performing doctor, you get a higher rate per surgery. So maybe it's $10,000 if you're per surgery from the insurer if you're doing well on these statistics, and $7,000 per surgery if you're doing poorly on these statistics. The basic idea with pay for performance is that the insurance company is trying to incentivize good quality medical practices.